Hey everybody, Michael Lepore, Sarasota Vascular Specialists, again coming to you on Whiteboard Wednesdays. We're going to talk a little bit about vascular screening and the importance of vascular screening. Again, I tell everybody and all of our patients that we offer a triple screen. We got involved in that years ago when we saw some of these mobile companies coming in and screening the vascular patients in Sarasota, but really not doing as good a job as I felt that could have been done when the patients brought us all of their information. The reason to do it is to identify a potential issue that could be treated, prevented from getting progressively worse, and avoid some really horrible complications that could be life-changing for everybody. So we start with carotid arterial duplex. That is basically where we use a probe to look at the artery with ultrasound, both sides of the neck, and identify if there's a significant blockage there that needs to be addressed immediately. Up to 1.5 to 2 million people a year could have a stroke prevented if they just got a simple carotid screening. It takes about 45 minutes and it's a lifesaver. Nobody wants a stroke. And then the next is aortic aneurysm. So down to the abdomen, that is a blowing up or a growing of the abdominal aorta that when it grows large enough can rupture and cost somebody their lives. So it's important again for you to know your history. If that's something you have in your family, anybody who has had an aneurysm, you absolutely should be screened by the time you're 50 years old. Some people would say even earlier. But nonetheless, it's a way for us to identify a problem with the aorta and screen it to prevent any future problems. And the last is a simple screening to check for peripheral arterial disease, ABI, which stands for ankle brachial index. We take a pressure at the ankle, we compare it to the pressure in the arm, and that generates numbers that tell us whether somebody's got mild, moderate, or severe vascular disease. Based on those findings, it may then cause us to look a little bit more closely with a formal arterial duplex of the lower extremities to figure out, or the aorta, to figure out where the blockages are. So once again, in summary, vascular screening, so important to vascular health, preventative care in order to avoid strokes, aneurysm ruptures, and any other problems with the legs. Michael Lepore coming to you on Whiteboard Wednesdays once again.
Thank you.